My breasts are lumpy. Is this normal? As you grow and develop, you will probably notice small lumps and other changes in your breasts. You might also find your breasts are sensitive and tender around the time of your period. If you feel a lump in your breast, don't panic, breast cancer is extremely rare in teens. For teen girls, the most common type of breast lump is usually just part of normal breast growth. Lots of girls and women have something called fibrocystic breast changes. This is when small fluid-filled cysts in the breasts change size based on where a girl is in her menstrual cycle. Because these cysts have to do with normal hormone changes, they are typically more obvious and may hurt a bit just before a girl's period. Fibrocystic breast changes are nothing to worry about and don't need any kind of medical treatment. Infections also can cause breast lumps. So can an injury to the breast, like getting hit in the chest while playing sports. If you're worried about a lump in your breast, talk to your doctor. Why breast lumps happen in women? Breast lumps in women can happen for a variety of reasons and are not always cancerous. Knowing the different kinds of breast lumps can help you understand your medical reports and help ease your mind. Cysts. A breast cyst is a fluid-filled sac. They often happen in women who are nearing menopause. You might notice them getting bigger and more tender right before your period. And they can form very quickly. They are typically non-cancerous and may be caused by blocked breast glands. They may feel soft or hard. Abscess. A breast abscess is a pocket of pus from an infection. It creates a sore lump in your breast, as well as inflammation. It can also cause fever, fatigue, and nipple draining. You'll need an examination, and it may be necessary to drain the pus. Fat necrosis. Johns Hopkins Medicine says that fat necrosis may form round and hard lumps in your breast. They are generally painless and caused by damaged and disintegrating fatty tissues. These types of lumps often occur in women with larger breasts, after a blow to their breasts, or following radiation for breast cancer. These are not cancerous and do not increase your chances of developing cancer. Fibroadenoma. Fibroadenomas are benign tumors in your breast. Some are very small and you can't feel them, but you can feel others. They're generally well-defined, movable, and not tender or sore. The exact cause of these tumors is unknown, but it's thought to be related to hormones. The American Society of Breast Surgeons Foundation says that these lumps are very common, occurring in about 10% of women in the United States. Galactocele. Johns Hopkins Medicine says that a galactocele is also called a milk retention cyst. These lumps are fluid-filled and caused by a blocked milk duct. They are usually found in women who are or who have recently stopped lactating. Hematoma. According to breastcancer.org trusted source, a hematoma is a collection of partially clotted or clotted blood outside a blood vessel. It may be caused by trauma or injury. These lumps may develop a week to 10 days after surgery. They feel swollen. And you might be able to feel the fluid inside the lump moving around. Sclerosing adenosis. According to the American Cancer Society trusted source, adenosis is a benign condition in which milk-producing glands in your breast, called lobules, are enlarged, and there are extra lobules present. In sclerosing adenosis, the enlarged lobules become misshaped because of scar-like tissue. Your breast may be painful. Because these lumps can sometimes feel like cancerous lumps, you may have a biopsy to rule out cancer and get a more accurate diagnosis. These lumps usually don't require treatment. What to do if you feel a lump? If you feel a lump, try not to panic, even though it can be scary or worrisome. Most breast lumps are non-cancerous, and there are many reasons a lump can form. It may be tempting to ignore it thinking you can wait and see if it goes away, but the best thing to do is call a doctor's office or clinic and make an appointment as soon as possible. Things to do while waiting for your appointment can include making a note of where the lump is, what it feels like, and if it is painful. Noting where you are in your menstrual cycle, if you are premenopausal. Noting if anything makes the lump better or worse. Talking with your relatives about your family's history of breast cancer and other types of cancer. Recalling when your last mammogram was done. Being prepared with this information can help complete your medical history and help a doctor discover what the breast lump may be.